We've been here before, and you've heard from me several times over the last 8 to 9 months. So I'm going to focus today on what's different and conclude with a metaphor on how we can help each other. So what's different? I think there's two major things. The first you've heard hints of already in direct data through this press conference, but I'm going to pull back to the bigger picture of initially the country went through a bit of a surge in March and April. We got it somewhat under control, only to surge again into July and August, and we got it kind of back under control. Over the last 3 weeks, we're not in a surge, we're in a spike. The rate of tests that are coming positive, the number of new cases just in the last couple of weeks has been staggering. And I don't use that word lightly. Many of us have been considering the possibility of a third surge coming into December after Thanksgiving and after Christmas. What we didn't anticipate was the spike before Christmas and before Thanksgiving. And so what I think has us all concerned is what you just heard Dr. Nafziger talk about. Our hospitals getting full, not just here, but all over the state. And after the cases are diagnosed in the spike, about a week and a half later, those cases turn into hospitalizations for a number of folks. And then that's followed another couple weeks later, unfortunately, by a fair number of deaths. So we as health officials, we as providers, but also we as a community would like to see that curtailed. And after Thanksgiving, I'm afraid if we don't change a little bit of what we're going to do together, then that spike will have a spike on top of it. And I'm a little bit overwhelmed, to be honest with you, at what that might look like. So that's the bad news. Here's the good news. You heard about the vaccine. These data are not just good, they're spectacular. Most of us, myself included, I wasn't sure that these vaccines would even work. I thought they might get a little bit of protection, 30, 40%, meaning that between the people that got the actual vaccine and those who got what we call a placebo or a non-active substance, that we would see about 40% more cases among the vaccine, the placebo group than the vaccine recipients. What we saw was much more than that. Normal vaccines, like say the flu vaccine, is 50 to 60% protective. These two vaccines were over 90% effective. That means, assuming the safety profile stays where it is, which is pretty good, these vaccines will not only be helpful to us in curbing the epidemic, we can start to even begin to think about eliminating this epidemic. And that's such an exciting concept for all of us. So we have these two kind of opposite things going on. A rising number of cases and genuine hope on the horizon. How long will it be before that hope becomes reality? In some ways, your guess is as good as mine, but I would say, based as we heard a second ago on the limited supply initially, for enough people in our community to be vaccinated, we're talking about into the summer of 21. So I would say let's focus on Thanksgiving next year. I think by that time, the vast majority of people who want to get a vaccine will have it. And that will reduce the number of transmissions in the community and start to bring this under control, hopefully to the point where the pandemic begins to exhaust itself. Wouldn't that be special? I think it's going to happen. So what do we do in the meantime? The best metaphor I can think about for this is imagine that we're all in a combat troop together. And I never served in combat, but I know enough people who did to know what this is like, what it's like. It's a band of brothers and sisters. It's people fighting in the trenches with each other against a common enemy. And as a community, that's precisely what we're doing. And for us to be effective, for not only ourselves, but for our brothers and sisters, we have to focus on what are the things we can do to combat this enemy. And to take the analogy a little further, We're on a tour of duty right now, and we know that our tour of duty ends by Thanksgiving next year. So what can we do to stay as healthy and frankly stay alive and survive this tour of duty and get home safe? What it's going to mean is all of us doing our part by minimizing our going out into crowds of more than 5 to 10 people for the time being, wearing the mask, washing our hands, and trying to avoid situations where we're around other people who aren't wearing masks. This is especially important around the holidays. I want to be with my family, and I'm going to be with a few of them, 7 to be precise, and we're going to be outside distanced. And I've gotten comments from a lot of you who said, how can you tell me what to do on my Thanksgiving in my home? I'm really not telling you what to do. I'm simply saying that we know our current situation, and we know what works in terms of protecting ourselves. And in my mind, since we're on this tour of duty together, I'd like to see us all make it to next Thanksgiving. And too many of our friends and relatives have already been affected by this, some of them becoming severely ill, and unfortunately, some of them dying. As a healthcare provider, I hate that. I genuinely hate that. And I look at my colleagues in the hospital, and I see them wearing out, and I see them becoming exhausted. And as Dr. Nafziger said, we will be there for you when you need us. But we need to be there for you, meaning we need to be ready, and we need to have our resolve and have our energy together. And the more we can work in partnership with you, us doing our part in the health system, but please, you're doing your part in the community. And if we do this together, we will successfully complete our tour of duty, and we can move on to a return to normalcy that we all desperately so much want right now.